we're now going into the opening ceremony with two items at the top of the masthead, if I may say. The first one, you're going to hear from the Women Who Deliver Vaccines Collective, and we're also going to announce the new initiative from the Nigeria Movement for Immunization Agenda 2030, supported by the Geneva Learning Foundation, part of Teach to Reach. We're doing a launch today. We'll be doing a more official launch later, and this is in partnership with UNICEF and the National Public Health and Community Development Agency of Nigeria. So, without further ado, I'm going to turn to Charlotte. It has now become a tradition at Teach to Reach that it is the Women Who Deliver Vaccines Collective who open Teach to Reach, and this is the opening ceremony. So, Charlotte, over to you. What are the Women Who Deliver Vaccines going to share with us today, and who is going to speak on their behalf?
Thank you very much, Reda, and it's always a great honor to have women who deliver vaccines to take the floor at Teach to Reach. Just to say that Women Who Deliver Vaccines is a collective of 143 women from 38 countries who came together in February 2022 to share experiences, to learn from one another, to support one another in the work that they are doing to address the challenges they were facing as far as immunization is concerned. And to start today, I would like to invite Margaret. Margaret, I'm asking you to unmute. Margaret Nabagala Tambazi from Uganda. You know, today we want to talk about the impact of climate change on immunization. And if you're able to unmute yourself, I am inviting you right now to do so. To unmute, tell us who you are, what you work, where you work, and what you do. If Margaret, okay, I see already unmuted. Margaret, over to you. We are listening.
Hello.
To you.
Hello. Can you listen to me? Do you hear me speak?
Yes, I can hear you. Yes.
Thank you very much. I greet everybody here. I salute everybody and I thank everybody, especially the organizers, for organizing this very great, enormous global interaction with all health professionals from across the globe. I'm called Dr. Margaret Nabagala Tambazi Kasita. I'm a public health specialist, and for quite some time I've been working with UNICEF as a UNICEF consultant in charge of Masaka region in Uganda. I'm also a Rotarian who has served as a past president in two clubs, that's Masaka Rotary Club and Luka Health Club. As a global organization also, Rotary also helps in participating, especially in seeing that polio comes to an end. So I've really served, when I was serving in UNICEF, I've really seen that we try as much as possible to solve public health issues, and I've joined Teach to Reach because this global organization really gives us a chance to share, to join other health professionals from across the globe, to share their work stories, their views, their experiences and challenges within their working environment. And this helps us also to see how they have managed those challenges and also to get solutions to some of them. So this really is very good. I joined the Teach to Reach for quite some time now, and I was invited as a guest of honor 3 times, although I missed the first 2. This time around, I think I'll be able to talk about it, and I really recommend and thank very much those who have organized this learning session, because we learn from different professionals from different countries, how they have really managed their challenges and how they're getting about. I shared my I don't know whether this is the time to share, but when they told us about the climate change, the climate change has affected globally. I mean, in my communities, because it rained heavily this past month, and so many people ended with no homes. The rains were too much. They destroyed so many houses, and also some food plantations. People went without food, and the end result is, of course, kwashiorkor and other malnutrition challenges, and also with a lot of rain, shambas and shrubs, and then bushes overgrow. We end up with the malaria, because even in the pools, malaria becomes rampant, and so many deaths, so many lives have been claimed because of a lot of malaria. Malaria is number one in Uganda as the number one cause of death. Thank you very much. I think I can get over to you, but there's a lot to share, but because of time limitations, I think I'll stop here. Thank you very much. Teach to Reach, please continue. Thank you. Over to you.
Thank you very much indeed, Margaret Nabagala. And for those of you who'd like to read more and learn more from women who work for health, for the International Women's Day, 177 women from Teach to Reach, from the Movement for Immunization Agenda 2030, from the new climate and health community, shared their experiences. And this has formed a collection of stories that you can get. You simply have to request it on the Geneva Learning Foundation's website. It's www.learning.foundation/women. You put in your name, your email, and you'll receive both the collection as well as a series of stories from women that you'll receive by email that can be shared with friends and so on. But Charlotte, before we hear the next speaker, we do have something very special for the immunization community at Teach to Reach, and that is directly related to the work done by the Women Who Deliver Vaccines collective over the last few Teach to Reach sessions. And this is why, let me see if I can find sufficiently dramatic music to introduce. This is a real first. We're going to ask you what you've learned from Teach to Reach, but we're also going to demonstrate it in a way that we never have done before. So this is two collections. One is of experiences and the other is of tips from the front line. And over the last few Teach to Reach sessions, we've had literally thousands of women and men who work on HPV vaccination, on cervical cancer prevention, and other areas of health who have shared their experiences. Our Insights unit, Charlotte amongst them, she's going to tell you a little bit about what's in this handbook and in the tips from the front line, have reviewed all of them, analyzed everything that you shared, all of the experiences, and there were literally thousands of them, to come up with what are the best top tips if you're involved in HPV vaccination. Charlotte is also going to remind us why cervical cancer is such a critical health issue. Charlotte, over to you. What is this HPV vaccination experiences and collection? Why is it important? How can health workers use it to make a difference?
Thank you very much, Reda. So like you said, over the past Teach to Reaches, we have been reaching out to health workers and asking them what they are doing to reach girls with the HPV vaccine and how they are addressing the challenges that they are facing. And we learned a lot from those experiences. We listened to experiences from national level Ministry of Health staff to the front line. We got country-based experiences from Burkina Faso, from Sierra Leone, amongst other countries, and we decided to take all of this. We got specific experiences from countries, like from health workers, community health workers in Kenya, on what they were doing to increase HPV vaccine uptake, and we put all of those in that experience sharing package. And then amongst all of that which they were shared, there were very useful tips, very useful guidance that was made available. How to engage community leaders, how to engage teachers, what strategies work best for HPV vaccination. So we took all of these and we put them in a second document that we are making available for you today. Why? Because the HPV vaccine is the best known way to prevent cervical cancer that affect yearly hundreds of thousands of women from across the world, and most especially in sub-Saharan Africa and in the undeserved community. So we think that if you are working in immunization, you should. This is a wonderful opportunity to get this handbook and the handbook of experiences that could be very useful. And it is from what you shared of what you are learning at Teach to Reach that we thought this could be a very useful tool. Thank you, Reda.
Thank you very much indeed, Charlotte. So look forward to this HPV vaccination. 2 collections. One is of the experiences. The other is really tips from the front line. Now we're going to turn to, I believe, Charlotte, you have a second speaker from the Women Who Deliver Vaccines Collective. We'd love to hear what she has to say as we are celebrating later today what we call Humanly Possible. It's the 50 years of the expanded program for immunization. Who shall we hear from next, dear Charlotte?
Thank you, Reda. So we have Gifty Akosua that's already unmuted. She's one of the founding members of the Women Who Deliver Vaccine Collective. And Gifty, would like to hear from you, especially the work that you are doing in immunization and also how climate change is impacting your work. Gifty, over. And please do start by introducing yourself.
All right. Hello, everyone. Thank you. Thank you, Geneva Foundation, for this opportunity. I'm Gifty Akosua Jigbe, public health nurse, and I also work in the disability field from Ghana in the Central Region, Gomwa West District. And I'm happy to be here with Teach to Reach once again. Yeah. So let me just go straight to the question. You were asking how... Please, can you help me with the question again?
So we say you talk about your work in immunization and how climate change has impacted that.
All right, thank you once again. So in Gomwa West District, I would say we work as a team. We do our best. I mean, in Ghana Health Service, you know that when we say universal health coverage, even in the hard to reach areas, you're supposed to go there to help children 0 to 5 years with immunization. But one thing that we were lacking was how we're able to how to bridge language barrier for persons with disability. And that was where I volunteered to actually come in to make sure that if we are advocating for universal health coverage, then we have to also make sure that no one should be left behind because of language barrier. And so voluntarily I started with my interpretation using the sign language because of seeing my own biological sister who became a deaf just because she missed measles vaccination. So I realized that women have a bigger part to play when it comes to immunization, because my mother, looking up to her after that experience, I realized she wasn't happy. And so she has become an advocate, making sure that all her grandchildren never missed immunization. And looking at that, I also took it up, and then using that or learning from my sister with the sign language, I have to also now implement it in my area where I'm working. And I would say this has really brought a lot of improvement, where I'm talking about where we see this group or this marginalized group with their families not even willing to bring out their children for vaccination because some have certain experiences with they giving a vaccine and then something happened to their child, or maybe somebody once shared something, and trying to clear all these misconceptions and trying to allay all the fears from them and trying to prevent this vaccine hesitancy. I would say that Geneva Foundation has really helped me to be able to help educate this community when it comes to vaccine hesitancy. And I've seen improvement, especially when it came to COVID-19, seeing how they were able to give out, they themselves willingly trying to take this vaccine. And also climate change, yes, I would say has really disturbed us, or let me say in a way, so positively and negatively. So positively, I would say that one, we need the rainfall, yes, because we need to grow our vegetables. But here lies the case. Now they are crying, asking that when are we coming for immunization, because we don't even have good roads already. It's a hard to reach area, and now how do we even use our motorbike, because if we try, you're going to fall. So I would say climate change has really caused a lot of harm, leaving some people there, and you have to just struggle before you reach them. Yes.
All right, thank you.
Thank you so much.
And over to you.
Indeed. Now, we've heard about immunization, and as I said, at heart, we started with immunization just when the world's immunization staff were being asked to introduce COVID-19 vaccination wherever they were. Last July, we launched a call to action to initially the Immunization Network and said, are you concerned about climate change and health? 4,700 of you responded within less than 10 days. And so we asked this question: is climate change a threat to the health of those you serve, and why? And you told us, most of you who responded, this is from a sample of 1,234, said that you were part of the family or a trusted friend. And now we asked you, is climate change a threat to the health of the community that I serve? Most of you assigned it the highest threat level and painted a very scary picture. We also asked you, do you worry about climate change? And this is why, for this 10th edition of Teach to Reach, at the top of the hour, we'll be kicking off our very first plenary session at Teach to Reach, entirely focused on the sharing your experiences, your observations of how climate change is affecting your community, and climate change is affecting the health of your communities. Now, in this opening ceremony, what we want to do is ask you the first set of Teach to Reach questions. As you know, before Teach to Reach, we ask you to answer questions, to share your experience. You can have a look, and we shared with you the shared experiences from Teach to Reach 8, 9, Teach to Reach 7. You can go back in time, and each time we ask a different set of questions. And these shared experiences provide deep insights that are also shared back as a synthetic report. For people who have no time, you can get the 2-page version, or you can delve into the literally thousands of experiences that are shared at Teach to Reach. What happens today is really an occasion to meet, network, and learn together through this conference and networking platform. If you're in our Zoom studio as a guest of honor, you're warmly welcome, but don't miss out the best part of Teach to Reach, and that is really to participate in the networking. And these one-to-one networking sessions are unique. You press on a button and you're connected to another health professional and can have a private conversation. So that is what happens at Teach to Reach. The next question is, of course, what happens after Teach to Reach? And this is where we're going to turn to you, because remember, the first questions we ask those of you who are not here at Teach to Reach for the very first time is, how have you used something that you learned at Teach to Reach to improve your work? That is ultimately what it's about, as well as developing your professional network. So 2 years ago, the Geneva Learning Foundation, working with a movement for immunization Agenda 2030 leaders, established the Knowledge to Action Hub. And really, Teach to Reach is part of this Knowledge and Action Hub. And everything you share will, one, be given back to you as a community. That is our first commitment to you. And second, we'll be asking you, what are you doing with what you learn? How is it helping you to make a difference? That is ultimately what we are interested in, and that is the process that we're starting today. What happens to what you share is that it is giving back to the community. Those who wish to be named will be named and honored as Teach to Reach contributors, and that is the Teach to Reach process. Now back to you, Charlotte. We'd love to hear. We have some questions, of course, for folks in the room as part of this opening ceremony. If there are if there are other people who'd like to speak on behalf of the Women Who Deliver Vaccines Collective, we'd love to hear them. Otherwise, we'll dive into this first question. Which Teach to Reach questions did you answer? What did you share? Over to you, Charlotte.
Yes, Freda. Thanks. I'm inviting Anifat Egujobi. Okay, you are unmuted. Over to you. And please do start by introducing yourself.
Good morning, everyone. Good morning, good day, depending on where you are hearing from me. I'm Egunjobi Anifa Tomawumi. I'm working with Lautech Teaching Hospital, Ogbomoso, Oyo State, Nigeria.
Yes, Anifa, we hear you loud and clear.
Yes. In fact, I like to be part of the Teach to Reach community, because it's always teach me then how to relate with people, how the immunization is going on. So I always have updates in Teach to Reach. Then about the people that I've invited. Yes, I've invited some people in my office. Then likewise in Oyo State platform, I invited people, and some of them have joined to Reach.
Wonderful, Anifat. Yeah. And can you tell me, Anifat, ahead of Teach to Reach, you received by email, of course, many different questions. We did not expect you to answer them all. Can you tell us which Teach to Reach question you did answer? What did you share from your experience?
Yes, I answered. I cannot recollect the one that I've answered, but I've answered many of it. Then I've answered many of them, like climate change. I've answered. Then I answered neglected tropical diseases. Then malaria. So any one of them have answered before.
And what, for example, on the subject of malaria, what did you share?
On malaria, I used to tell my people in my community about the causes of malaria, what causes malaria, then if any of their children or pregnant women have malaria, what to do to them. Like they should not just neglect those people that have malaria. They should make sure that they take them to the nearest hospital. There's hospital or community health in their environment. So,
all right, thank you, Anifat. And what is, for example, on the subject of malaria, what would you like to learn from your colleagues, from their experience, if they're confronted, for example, to this question of caring for pregnant women who are affected by malaria?
well, for what I would like learn more is that another way of treating malaria, like in my place, I told them I've already informed them about uses of bed net to be using. Then I've also informed them about when they have malaria, they should take some drugs or they should go to their nearest health center. Then do and don't, they shouldn't allow the mosquito bite at all to bite them. So I've already told them about that. So if there is any other thing that they can learn more on the malaria issue, they should also, I am expecting my colleagues to teach me so that I can always impart some knowledge into my community to tell them what to do and what not to do in order not to combat malaria.
Thank you, Anifat Egunjobi. I think we owe you a round of applause for this contribution. Thank you for making time to be here today. This is right now the opening ceremony, and we are now going to spend the next 38 minutes hearing from you about your experiences around these kinds of questions. We are also interested in what you expect from Teach to Reach 10. What challenge do you need help with? And for those of you who participated before, name one specific idea that you learned at Teach to Reach, and how has this idea helped you? So these are the kinds of questions. If you would like to answer them, if you're with us in our Zoom studio, you can of course raise your hand, and I see many hands raised. And if you are in on the stage in the conference platform, in that case, I encourage you to type into the either in the Q&A or into the chat. This opening ceremony is really about getting to know each other and really looking at all of the range of issues that we're going to be exploring through the sharing of experience, through the power of peer learning at Teach to Reach 10, this 10th edition of Teach to Reach in English. Tomorrow will be the sessions for the Francophones. Before I turn to Charlotte and Maria for our next speaker, I want to, this one caught my eye. Susan Adina says, "Oh my heart has been fully captured by this forum. I'm now ready to change my current career if I can be trained to do professional community work. I'm not a health professional, but I'm currently doing some community work under my small CBO known as HEAL." And she says, "Reda, kindly help me to do community work. I want to be with the people, not in the office anymore." So Susan, perhaps there are some organizational leaders who are participating as Teach to Reach partners that you can who can reach out to you. And Farm Bernard Badu Bediako would like to share on malaria. Now, let me just remind you, there is a dedicated session on malaria. Right now, but what we want to know in general is, at this stage in the opening ceremony, which Teach to Reach questions you've answered, what did you share, why, and so on. So I don't know whether to turn to Charlotte and Maria. We've never had the options like this before.
So Reda, we have some mics that are already open, but I think we'll go first for those that have not spoken since we started this morning. So Nduka Ozo, we'll start with you, and then we'll also apply our rules of fairness. So if a man speaks from one country, the next person should be a woman from another country. So we'll start with you, Nduka Ozo.
Good morning, everybody. Good afternoon. Good evening, wherever you're watching from. My name is Mr. Nduka Ozo. I've been up since 7 a.m. I've had a network meeting this morning. It has been wonderful, and we've exchanged contacts, which we hope to continue after this conference. I answered so many of the questions, but the one I want to talk about here is a non-tropical disease, which I shared a very heart-rendering story of how a community in Kukereta in Damaturu, that is Yobe State, during one of our outreach programs. Everybody who is familiar with the Northeast Nigeria knows that it was devastated by Boko Haram insurgency, and a lot of people went into the bush to live. And while they were in the bush, they mixed up with animal diseases and all that. I shared a story of a 6-year-old boy who turns out to be the head of the family. And this boy and the rest of his siblings were all infected by viral hepatitis B. And then, unfortunately, there wasn't any program on ground in the States at that time to support these kids. On my own, I tried what I could do to help them. But for the fact that I'm not from that state, I am from the southeastern part of Nigeria, but I moved to work in Yobe State because of the passion I have for the people affected by the insurgency. So I tried on my own to see how I can help these children. And I stayed there for 2 weeks and then rendered the little help I could render, and then went back to my community. After some months, I came back. And the first place I went was Kukereta IDP camp to ask for those children. Unfortunately, they were all dead because of the hepatitis infection. There's no treatment, no vaccination, no kind of support. Even at this point, at the national level, we only have built on the documents, but there is no serious intervention program on viral hepatitis. And that was the story then. I asked another question. How do we go about this? How do we help these people who are infected, who are affected by these non-tropical diseases? There is a global fund for HIV. There is a global fund for malaria. There is a global fund for tuberculosis. Even the last COVID, we saw the whole world stand still because of the COVID. But that was understandable because of its devastating effect. But here in this world, especially in developing countries like Sub-Saharan Africa, we don't have such funds to combat non-tropical diseases. Why is that lacuna there? I think the world has to do something about it because it is affecting the most vulnerable communities around Africa. And what I shared about Kukereta in Damaturu is not just a fiction. This is a story of what happens, and it's happening in other parts of the Northeast. And that is where I carry out most of my activities. If you go to the villages and communities, you will weep for these communities. And I think the world should focus and do something about it. Thank you.
Nduka Ozo, thank you. We hope to hear from you again in the NTD session. We thank you also for having shared this story in the lightning chat. What do you expect to gain from meeting colleagues, sharing this story with them, listening to the stories and the experiences that they have around difficult challenges, such as the one you just described?
Reda, from the little conversation I had with some of the colleagues in the network meeting, I think it's something that we can take further from there. I want to learn how they are carrying out their own intervention, advocacy programs, program designing, crowdsourcing strategies for community intervention programs. We've spoken a lot, and I think there is so much I can gain from there. I am so excited. I can't wait for this conference to be over so that I can start making those networks and we start discussing, and it will impact in what we are doing here in Nigeria effectively. I'm too sure of that. Thank you.
And Ozor, you are obviously a very talented, smart organizational leader. You have many options. You could go to the websites and find guidelines, guidance documents, resources, tools from all kinds of organizations in your country at the global level as well. You could connect to webinars where technical experts make presentations and explain the best available global knowledge on some of these issues. What for you is different about Teach to Reach, and why is it worth your time? Because I'm sure you have many other things you could be doing this morning since 7 o'clock in the morning.
Yes, the fact that we are listening and we're getting information from the community-based organizations, community health workers, people who are dealing directly with the affected. This is where it is important. I'm not just talking about people who stay in the office, develop programs and develop activities and then take it off. But these are people who are dealing directly with the hard to reach people, with the community people. This is the most important thing for me. I am not talking about theory. We're not talking about theories. We're talking about practical experiences that we can apply in the work we do. Thank you.
Indeed. Thank you very much indeed. Now, the heart and soul of Teach to Reach. You're going to see it here. I believe Charlotte and Maria, the time has come. We're at the halfway mark in this opening ceremony. As you know, we asked you many, many questions, and I'm pleased to say you're seeing the beginning of a list that is 44 pages long of more Teach to Reach participants who have taken time to respond to one or more Teach to Reach questions in which they're sharing their experience on a specific topic. So I suggest we go right into it, and we really do justice to the commitments. This will take a few minutes, but the names are in alphabetical order by first name. If you shared, then please consider yourselves honored and recognized today at Teach to Reach 10 for sharing your experience when nothing, you had no obligation to do so, and you did so because you wanted to. On page 444. Teach to Reach is about what you know because you are there every day. And sharing that knowledge, not just with the colleagues around you, but with colleagues from all across the world, is called peer learning and can make a difference. For those of you who are just joining now, these are the names of all of the Teach to Reach contributors, together with the information they provided. Each person here shared an experience, responded to one or more Teach to Reach questions. This is the core knowledge that goes into Teach to Reach. You'll hear today a few voices during the live sessions, but these Teach to Reach experiences combined bring together thousands of experiences, what you know because you are there every day, what you are doing about it, across a range of topics, including but not limited to climate change and health, neglected tropical diseases, malaria, and of course immunization, which is where Teach to Reach started. Maria Monzon has contributed, has answered many Teach to Reach questions before joining our team. Maria, what are your thoughts when you see how can you tell us about your experience in the past listening to receiving so many questions, figuring out which ones you had experience to share on? Why did you do it, and how did it help you?
Thank you, Rita. Well, I think the main reason why I did answer it, one of my tricks was to answer them right away, because as all of us, we're very busy, and when you postpone, I guess you never find the right time. So anytime I would see one of the TGLF's emails, I would find like 5 minutes to answer them right away. And I did so because I knew it mattered, because I knew that I would get the experiences from other people, and that was enriching. So it's never to leave that opportunity pass.
What you're seeing in front of your eyes is the names of all of the Teach to Reach contributors. As you know, over 21,000 health professionals are registered. But of those, we especially honor and commend the more than 1,500 who have shared a specific experience in response to one or more questions. I believe the record is Tafaroder Mutonga. I hope we can stop on her name, and I was hoping she would be in the room, but she's not, who answered 40 Teach to Reach questions during Teach to Reach 10. But it's not about the numbers, it's about the quality of the experiences that you share and how each experience can help your colleagues. Charlotte, what are your thoughts? As you see, we have 44 pages of names scrolling before us, and these are the names of people, actual health professionals who took their time out to share their experience, and this is the backbone, the roots, the foundations of Teach to Reach. What are your thoughts? You've seen Teach to Reach built by thousands of participants, by our small team as well. What are your thoughts as you see this list? What does it mean to you?
Yeah, rather, I am overwhelmed and honored by the generosity of frontline health workers, those that choose to share what they are doing to make a difference in their communities, and also sharing very personal stories, in some cases of what they are learning, what the challenges they are facing, maybe their failures, and also the hope that they have when it comes to primary health care and primary health care intervention. So I can just join you and the rest of the Teach to Reach team to honor these contributors. Thank you, Reda.
If you see a name more than once, it is because Nicholas Kashama, for example, contributed more than once and contributed many times.
Yes, Reda. And that was one person we have to honor, as well as Taporode from Kenya, who took the time to respond to almost all of the Teach to Reach questions.
That's right. And if you did not answer a Teach to Reach question this time, you are still warmly welcome to the Teach to Reach family, and we look forward to the opportunity to answer a Teach to Reach question next time. But these are the health professionals who are contributing to the knowledge generated by Teach to Reach. Today is an opportunity to learn with them and also to share your own experience as well. List of names are those of you health professionals, thousands of health professionals who've taken the time and care to share their experience for the benefit of their colleagues. This is the heart and soul of Teach to Reach before Teach to Reach, and you'll get to network today, meet, network, and learn with them today in the networking sessions as well as the plenaries. right, you can see we're almost there. We had the names that begin with Y. And here...
I just wanted to add that these stories are stories of resilience, experiences of resilience from health workers who have no intention of giving up no matter the challenges because they have the health of their communities at heart.
Wonderful. Thank you very much indeed, Charlotte. And now we're at the 40-minute mark for this opening ceremony. We wanted to take this time. And yes, it takes a few minutes, but we really feel it's important to recognize and acknowledge and then to give back to you the contributions that you've made and to honor the contributors, the health professionals who've taken time to share. Teach to Reach participation has been ascendant. You can see actually in March 2021 there were 2,604 participants. June 23, 16,835 participants. A little bit about who attends. So there's a growing global community. Most of you work in health facilities and districts, around 80%. Half work for government, half for civil society organizations, half for francophones. And then you can see some of the other statistics here. But 1 in 5 of you face work in places where there are armed conflict. And again, it's always about the connections that you make with each other. It's not about the relationship you have with me, Charlotte, or Maria at the Geneva Learning Foundation. This is social networking analysis mapping the connections that you made with each other. There are 2 clusters because of francophones and anglophones. But this is peer learning in action. And now back to you, Charlotte. This has been a long but worthwhile sequence. I'd love to hear more voices, before we make the announcement for the Nigeria Movement for Immunization Agenda 2030.
Yes, Reda, I am inviting Gloria E. Banu, whose mic is already unmuted. Gloria, please go ahead, introduce yourself and answer the questions. Gloria? Are you able to hear me?
Yes, I am able to hear you. Just that I have to change to my to my phone because my laptop will soon go off. So my name is.
While you do that, okay, please go ahead.
Yes, my name is Mbanu Gloria E. I am a lecturer with the University of Agriculture and Environmental Sciences, Omaogo. I'm the Executive Director of the Initiative for Infectious Disease Control.
Gloria, could I ask you to turn the volume down on your other device because we can hear it's feeding back into the your microphone.
Okay, in that case, let me put off my laptop because it will soon go off, and then use my phone now. Thank you.
Okay, so while you do that, maybe we can listen to someone else. Lilian Mutua.
Yes, go ahead, Lilian.
Morning.
Welcome to you.
From Nairobi, Kenya.
Yes,
am I audible?
Yes, loud and clear. You told us you've been able to learn how to negotiate with deserving, hard-to-reach communities and learned communication strategies from Teach to Reach. You've seen the power of decision-making lie with the people. So tell us what you mean by that. And first, do introduce yourself.
My name is Lilian Mutua. I'm the head of health promotion. I work for Nairobi City County, the health sector in Nairobi, Kenya, which is the capital city of Kenya. Why I'm saying this is that through the interactions that I've had in Teach to Reach, and even when I look at the questions that people are answering, the interactions, I found that globally, each country has its unique barriers or challenges that they are facing during the delivery of immunization. And more so, I've learned, especially in Africa, we find the same challenges. We have the hard to reach communities, we have the 0 doses. But when I look at Nairobi, being a capital city, 60% of my population lives in the informal settlement because they have migrated to Nairobi to look for livelihoods. The uniqueness is that when you're trying to reach these communities, you'll find the parents, the caregivers, or the guardians wake up very early to go to work. Their priority is to get something for food on their table, to get something for their shelter, to educate their children, and more so immunization comes as another a secondary issue. So most of them are young parents, young people, and we have learned, what I've learned through my experience of listening to the sessions that we've had, is that I now focus to deliver information about immunization, not when the parent has a child, but even way before, starting with children in school, so that they can be the agents of change in their communities, at their households. They're also able to feedback whether their children who are born within their household are getting information, and that way we are able now to connect with the community health promoters to go and trace whether there's a child who has been missed. We also are now negotiating with the religious leaders, the administrative leaders, the influencers in different communities, and the decision makers who are the gatekeepers. So it has been brilliant that I've also learned what Nigeria is doing, what Pakistan is doing in the HPV vaccine delivery. And I'm looking at Kenya, where we are at around 33% of the target population at first dose, and less than 20% for the second dose. So the learnings that I've taken, I'm listening to different strategies and different ways that different countries are empowering the communities to make decisions to take up different types of vaccine. Nairobi is also very unique because the affluent community, which is 40%, normally they go to the high-end hospitals, but we are not able to negotiate with them. So through them, to reach them, we use the churches where they go, the religious institutions, the various religious institutions, their social leagues, different communities like the Rotarian, the Hindu Council, and other religious institutions, so that we are able to reach this information with them. We are also using the media, we've engaged different medias, and also strengthened our partnership with them just to promote the issue of routine immunization and the life post vaccines. I know as Nairobi County, we take lead in Kenya in delivering of the COVID vaccination. We are now at 69%, while the national coverage is below 50. So I really appreciate the learnings I'm getting here, and especially being a health promotion officer, the different strategies that people are using on the ground for demand creation. Thank you, and over to you.
Thank you very much indeed. We are in this opening ceremony exploring what challenges you need help with. How can Teach to Reach help you? This can help also some of the participants who are listening to say, hey, I have an experience with this. Maybe I can try to connect with the speaker. That is also very much what we are hoping for. What we are hoping will happen at Teach to Reach. Now we have 13 minutes left. I believe Charlotte has our next speaker ready to go. Charlotte, we do need to do the first announcement of the Nigeria Immunization Agenda 2030 Collaborative. There will be a second announcement later. Go ahead, Charlotte.
Definitely, Reda. So the mic that is open, Suzanne Adina. Suzanne, you have the floor, and please do start by introducing yourself.
Hello. Thank you. My name is Susan Adina from Kenya. Can you hear me?
Yes, loud and clear, Susan.
Yes.
Tell us what you do and what challenge do you need help with today at Teach to Reach? How do you think peer learning, sharing of experiences from colleagues from all over the world who are here today can help you with this challenge?
Okay, so first I'm a psychological counselor in a university in Kenya. So in my day-to-day work, I interact with a lot of issues, and then I do community work through my small CBU, as I indicated, known as CBU. That's just personal work that I do with a few women in the village to try and handle a few things that come in. So my main challenge that has made me to get interested in Teach to Reach is the neglected tropical diseases, largely. Malaria is a problem here. Then we have the area where I come from, we have jiggers. I don't know whether You've heard about jiggers. Jiggers is quite a problem here as well because of the heat in this area. So mainly, I would just be interested to know, we have nets. The government gives us mosquito nets for the net beds, but we still have very high levels of malaria in this area. This is because the mosquitoes are not biting people when they are sleeping, but they are biting people when they are still seated within the house, not when they are in the beds. So I'll be interested to hear from the professionals, how can we be able to eliminate the mosquitoes that are around when people are still seated in the evening before they sleep? And then I would also be interested to inquire, can the malaria vaccine be administered to adults? Because in Kenya today, the malaria vaccine has been introduced for children. I don't know whether it can also be introduced to adults. Like in my house, almost every week we are getting attacks of malaria. And so that means within every 2 weeks we have to take malaria treatment. And I'm getting worried that at that rate of always being on malaria treatment, it may be risky. We have nets, new nets, brand nets, which we've bought, others have been given by the government, but we are still struggling with malaria. And my last challenge is largely about the climate itself. We have challenges of fluctuations in the climate, so people are not getting food. They plant food, rain disappears, food goes. They plant food, too much rain, the food disappears. So this then impacts on the nutrition of the children and the entire families that are here, because the feeding becomes quite a problem. I'm in a very poor rural village in Kenya, and that's why I have a special interest here to see what I can do. I hope I've answered the question.
Thank you very much indeed, Susan. Adina. All right. Wonderful to hear the challenges. So we're not going to try to answer any of these questions now, but we want to feel the pulse of Teach to Reach. What's on your mind? What are the challenges on your mind? We only have 8 minutes left. And dear Charlotte, we do have the first announcement. We'll be making a second one during the EPI at 50 session. And I believe we are now going to share this exciting announcement, specifically of interest to Nigeria scholars and Teach to Reach participants. Charlotte, are you ready?
Yes, Rada, I am.
All right, so and of course, first of all, we're very proud of the amazing community of Nigerian scholars, the largest in the world in the Geneva Learning Foundations network, followed closely by the Democratic Republic of Congo. Countries from all over the world, 137 countries are represented, but we're very pleased to introduce this today, and we look forward to, perhaps we're going to lower all the hands and ask our Nigerian colleagues who are with us in the Zoom studio, or if you're on the stage in the conference platform, to get ready to share your questions and comments and to react, because this is for you. So here we go. Charlotte, can you tell us what we're looking at here?
So it is the very first immunization collaborative for families and communities in Nigeria, and it's an initiative that is championed under the banner of the Movement for Immunization Agenda 2030, supported by the Geneva Learning Foundation, UNICEF, and the Nigeria Primary Healthcare Development Agency.
Indeed, and you can go right now. Applications are not yet open, but if you are from Nigeria, or actually if you're not, we're going to explain that. You can go to the learning.foundations/Nigeria page, and you'll see additional information about the Immunization Collaborative for the children and families of Nigeria. The goal is really to share experience, but this time where Teach to Reach stops at the sharing of experience, and then we ask you in the follow-up, what have you done with what you shared, what you learned? Here we'll be really focusing on taking action with fellow professionals to strengthen routine immunization, and we're very proud to be doing this in partnership with UNICEF support, and of course in partnership of the National Primary Healthcare Development Agency of Nigeria. If you are a health worker in Nigeria and you want to make sure every family is protected from diseases that can be prevented by vaccines, this is for you. It does not matter who you are, what your job is, or where you work. What matters is that you want to make a difference for the families of Nigeria. So now over to you. We're going to go back to the... we're going to get some reactions from Nigerian participants. If you are from Nigeria, whether or not you have been participating in the planning and design meetings for this immunization collaborative, we'd love to hear your voices. We lowered all the microphones, but we know there are many Nigerians in the room. Let's go look on stage to see if there are any reactions. So we have Dr. Kaiser Parviz from Saudi Arabia, Adamu Haruna from Sokoto, Nigeria. Haruna, what do you think of this initiative? And Catalina from the Republic of Moldova. So, all right. So we're waiting for our Nigerian leaders of Immunization Agenda 2030 to raise their hand if they're in the Zoom studio to share their comments. All right.
We have to raise hand.
I see. Yes. Who shall we hear from first, Charlotte? We have just a few minutes left. We'll be making a more complete announcement in the afternoon session, humanly possible. Vaccines work really focused on this 50 years of EPI.
So rather we have Fanny Ogu, whose mic is already open. So Fanny, we'll start with you.
All right, go ahead, Fanny.
Hello, everyone. Hello, everyone. I'm down with cold. I've just sent a message to you, Charlotte. My voice is not audible at all. Thank you so much. I'm Ambassador Fanny Ogu, a public health specialist, immunization professional. I'm down with cold. I'm so sorry. My voice is down. My voice is not audible. I've just sent a message to
So sorry to hear that, Fanny, and we wish you the quickest recovery. And so we'll go straight away to Ndayo Iwat and then Mohammed Otaru Reda to conclude.
Thank you, Charlotte. Thank you, the Geneva Foundation. We are the president. I want to introduce myself as Dr. Iwat Ndayo.
Dr. Ndayo, can you please unmute yourself again?
Okay, I'm unmuted now. I hope I'm fine.
Yes.
Am I audible now? Okay, thank you, Charlotte. And I'm still appreciating the foundation for this important occasion, and congratulate ourselves too for being there as always. Remember, as pioneer scholars from Nigeria for the Geneva Foundation and right now ambassadors, I want to say that we have been complaining about the involvement of the leadership of immunization programming in the country, and this is a groundbreaking initiative, and I'm sure MPSCDA leadership and the Federal Ministry of Health and Social Welfare in Nigeria will be absolutely connected with this focus that is so strategic and global, so that we can act locally to ensure that no child is left behind. And the life course immunization programming is also in view, and I want to say my actions in the immunization programming took a boost when I joined the Geneva Foundation from inception in this country. And I want to quickly put what happened when we rolled out the first launch of HPV vaccination in the country, and I was participating with support from Gavi and in the social mobilization and advocacy, communication and social mobilization aspect, and I dealt with one district in the Federal Capital Territory of Nigeria. It was a huge success, and my reports are all there for people to see. What did I do? Community dialogue and community engagement insights from the ideas I got from the Geneva Foundation really put me up. And we had a vaccine champion, and I've recommended to the district, to the area council in the Federal Capital Territory, that resolution of hesitancy and even forestalling hesitancy could be achieved with absolute community engagement, which has been lacking in the immunization landscape in this country. So if we engage the community and let community participate actively in immunization programming in the country, I believe that we don't have any problem spending money. People always say there's no money. We don't need funding for parents to take up responsibility and take care of vaccines that do not need injections. The oral vaccines will be given by parents. So I want to
thank you very much indeed. We now have to shift to the next session, but we heard one Nigerian voice. We will be launching the Immunization Collaborative this afternoon during the 50th anniversary of EPI, and very proud to be doing this with UNICEF and MPHCDA.